Okay, welcome back. This is part 6. We're going to get into altermentation and syncope. Syncope is fainting. It's a temporary loss of consciousness. Syncope is the medical term for fainting. It's usually caused by a decreased blood flow to the brain. It could be rapidly changing positions. So from laying down to standing up real quick. You guys have all might have experienced that head rush. In a normal, healthy adult, that head rush is actually normal. That is your body compensating and constricting and dilating the blood vessels for that kind of, for lack of a better terms, that altitude change. Some people have problems with that. Some people that when they stand up too fast or if they stretch too hard, it can actually decrease the blood flow to the brain and they could pass out. Dilation of the blood vessels or any kind of decreased cardiac output will all cause a syncopal episode. I think the big treatment plan for when it comes to patients with syncope is to make the patient understand that passing out or fainting is not normal. Okay? They need to go get checked. There might be some kind of underlying condition which ourselves as EMS might not be able to find on this patient. But we want to lay them flat. We want to loosen any tight clothing. We want to make sure that we are administering O2, just kind of comfort measures based on whatever the readings that we're getting on the oxygen saturation. And we need to do a lot of ruling out. Is this a cardiac cause? Is this because the patient has a low blood sugar? Did the patient have any past history of any traumas, any recent traumas? Any kind of dehydration? Are they eating correctly? Okay, that's stuff that we have to kind of think about. Are they taking medications? Are they taking new medications? Do the doctors change any of their medications that they might be taking? And are they taking their medications like they're supposed to? And yes, we need to get an ALS unit there because I would love to take a look at their heart. I want to get them on the monitor. I want to get them an IV. I want to give them some fluids. I want to watch their heart and make sure that everything's okay with that. Those are two big of the rule outs for a syncopal episode that we need to definitely do for syncopal episode patients. But we want to really encourage these people to get to the hospital just in case there's something underlying that we can't see. Okay, so with altered mental status, it is a very common neurologic emergency. Definition of altered mental status is the patient isn't thinking clearly or is incapable of being aroused. The patients will be unconscious, and others patients may be alert and confused. So it's this whole kind of range of a spectrum that could be going on for altered mentation. So guys, we use something called the Glasgow Coma Scale to kind of see where everybody is at based on a mental status. Okay, it's composed of 3 different components. They're eye-opening, and if you guys look at it, it's spontaneous to voice to pain or none. It's actually your AVPU scale: alert, verbal, painful, or unresponsive. And we also have a verbal response and we have a motor response. And based on these responses is how we end up getting a score. This is actually created for patients that are in comas. And this is a way for the doctors to see if the patient is improving while they are in a comatose state. And this is considered a vital sign, okay? And this is something that you guys are going to have to learn. This is something that you guys are going to have to learn with experience, in my opinion. I want you guys to look this over. I want you guys to kind of know the point system and how it works. There's a great little there's a great little reading, like paragraph or 2 paragraphs in your book that you guys might want to read on. I'm not going to spend too much time on this. I'm not going to have you guys actually find me a score of your Glasgow Coma Scale. If we do, it will be for extra credit on your exams. So really what I want you guys to know is just know that this is a vital sign that we use in order to help with the mentation of the patient. And then the actual components of it, the eye opening, the verbal response, and the motor response, knowing that the eye opening is the highest score is 4, verbal the highest score is 5, and motor the highest score is 6. And we add those up, and the higher the score, that all those together will give you a score of 15. That is an alert and oriented patient. You guys will go a little bit more into this when you guys get into paramedicine. We always say that a GCS less than 8, so we need to be prepared to intubate our patient. So it's something that we use in paramedicine a lot more than you guys do. Understand that this is a vital sign, and understand that you guys, for extra credit, may have to tell me the actual Glasgow Coma Scale score for a patient. Okay, and another mnemonic that you guys need to learn and commit to memory. AEIOU tips, and these are kind of to help us rule out causes of altermentation. The first A stands for possible alcohol or even altitude, specifically out here. We're a little higher than people are used to, especially when it comes to the balloon balloon fiesta, sorry. They come from all over the world to see the balloon fiesta, right? Well, we're a little higher than a mile up in the air, and some of these people come from sea level and want to come and eat our green chili and hike our mountains, and they can get altermentation from that. We'll talk about that more in our environmental lecture. Seizures, epilepsy and electrolytes. They could be an electrolyte imbalance. They could be an epileptic. They could have had a seizure, and when you show up, they might be in their postictal state. The I is for insulin. We need to remember that this patient might be a diabetic. We need to make sure that we're checking the blood sugar on this patient. Could be an overdose. Uremia is actually toxins, kind of reminds us for infections, toxins due to some kind of kidney failure or liver failure. Trauma, shock, or some kind of head injury. Infection is the next one. They could have some kind of wicked systemic infection that they might be fighting, which can lead them into a altered mental status. Psychosis. Guys, they could just be playing possum with you, right? They could be fake altermentation, all right? Some kind of psychosis. I would also add poisoning to that P, to keep in mind that I think poisoning probably can go with an overdose as well, but just remember it could be also a poisoning. And then the last S is a stroke. These are the main reasons why people have altered mental status. And this is just a good mnemonic for you guys to help you rule out everything if you do get to that patient and they are unconscious and responsive. So when we're talking about caring for the altered mental status patients, no matter what's going on with the patient, we want to make sure that the patient is positioned correctly. We want to make sure that this patient is not supine, because if they truly are unconscious, they cannot control their airway, which means that if this patient does end up vomiting, we can cause an aspirated pneumonia. So this would be a good time to roll that patient into the recovery position, or possibly sitting this patient up and being prepared for this patient to actually vomit just in case. So have your suction ready if it comes down to it. Okay, support the ABCs just as always, guys. It's a patient. We're going to do airway, breathing, circulation. We're going to try to keep the patient warm and maintain their body temperature if we are dealing with some kind of cold environment. We really want to check a blood sugar pretty quick. Okay, specifically if we are dealing with somebody with a low blood sugar, that is a life threat, guys. We need to be able to get sugar on board in order to keep their brain and organs functioning. So we're going to move up. Right, we're going to move up that vital sign and a little bit further up into when we would usually do it. We want to check a sugar right off the bat. So anytime that you guys are dealing with the AEIOU tips, please make sure that you guys are checking the sugar after you guys are securing the ABCs. We may need to go quick. If we can't figure out what's going on with this patient, there might be some kind of metabolic disorder or possibly some kind of trauma that happened to this patient that we're not seeing any signs and symptoms of. We need to get them to the hospital in order to try to stabilize them. All right? And if it's just a weird situation, remember you guys can always call a doc and see what they think. Remember that the doc's going to want to know demographic information. How old is your patient, male or female? What's your vital signs? What were you guys called out there for? Make sure that we're checking for medical bracelets on these people, medical necklaces, anklets, anything around their wrist. We need to check their cell phones to see if they have their in case of emergency set up. Most of the smartphones now have an app for people that actually have medical conditions where their phone is locked But if you look at the home screen, you'll see kind of the American Red Cross symbol down in the lower left or lower right of the phone. And even though that the phone is locked, you can open up this app. They can have everything filled out for you, all the demographic information, their address, their phone number. They could have power of attorney. They can have DNRs on file. They can have their whole medication list and who to call in case of emergency. And the cool thing about it is that you can call from their phone through the app. You can call from their phone, even though their phone is locked. It'll call that person for you, and you can get information from that person, or at least let that patient know where you guys are going to be transporting that patient, so that they can come and help out their buddy or their loved one once they're done with the hospital. Guys, I'm not going to spend too much time on infections. I did jump ahead a couple slides just so you guys know. You guys can read up on that stuff with altered mentation. I do want to mention a couple things about infections. Make sure that you guys do know that there are infections of the brain or the brain tissue, encephalitis, which is actually inflammation of the brain tissue, and meningitis, which is actually inflammation of the layers of the brain, or the meninges as we call them. Okay, you guys will get a lot of training on this when you guys get into your services, on the actual proper PPE that you guys need in order to come into contact with these patients. You guys will get that training when you guys get into your services. Okay, so I'm not going to spend too much time on that. There are some great classes out there that you guys can also take for CEs based on these subjects, which I highly suggest you guys do, because we are famous for meningitis out here in the state of New Mexico. In fact, the hantavirus, West Nile virus, they're all kind of signs and symptoms of these based on encephalitis or meningitis. Make sure you guys are taking those classes for CE so you guys can keep up to date with all that knowledge. And then after you guys have learned all those AEIOU tips and whatnot, remember that the number one reason why people have altered mentation is because they are hypoxic for some reason. So make sure we give them some oxygen, guys, right? And see if we can clear up those cobwebs to kind of help them out and get their mentation back to normal. Okay, ladies and gentlemen, I'm not going to go over that secondary assessment stuff with you guys. I think if you guys read through those slides on secondary assessment and the actual reassessment of the neurologic patient, it all kind of makes sense. The thing that I do want to point home is that make sure that we are always taking care of the ABCs. Make sure that we are moving up the BGL, specifically if we're dealing with somebody that is unresponsive or unconscious. And we want to make sure that we gather a sample history pretty quick. As soon as we can, to be honest with you, just in case this patient does decide to go unconscious on us again. We want to at least try to get that sample history for the doctor, specifically the allergies and the possible medications with the past medical history that our patient might have. As always, if you guys have any questions, please feel free to email me. Bring them to class next time we meet online or in person, whichever kind of class you're taking. Enjoy these. If you guys have any questions, please get a hold of me, and I will do my best to get back to you as soon as possible. Again, thanks for joining me, and we will see you guys next time. Take it easy. Be safe.